This is show you the information people are paranoid about, and how ridiculous the information is, and you should not be concerned, I don't think, about the COVID-19. And this is about in England, and you notice that see, they say things. Look, people, they have questions about the hospital admission. See, for COVID-19, and this is true all over the world, can be interpreted in different ways. See, depending on only those who tested positive or already in the hospital. Does it include people who had COVID-19 symptoms prior to admission? And those symptoms could be anything, as you saw, a wide variety. How do they know it's COVID-19 symptoms? Or were admitted for other reasons than the COVID-19? In other words, you could be admitted for any one of the 15 items that are listed by the CDC as COVID symptoms, and be counted as COVID or not. I said, look, we do not know the answers to these questions, but they're willing to shut down the economy. See, and here's England, some of the stuff that's going on, and see, look at this. The definition for hospitalizations is a different definition than used on April 1st. Okay, so the public is getting shut down and ruining the economy, and these people don't have the answers. See, and it said hospitalization implies the numbers were admitted to the hospital at the time of infection. Well, how do they know there was an infection if the symptoms could be anything? And you'll see that later on, that this is true. And so you see the word for indicates the patients are only in the due to COVID-19. It implies causality. But the fact of the matter is, there is no marker for COVID-19. There is no marker for COVID-19. For mumps, yes. Ebola, yes. Polio, yes. Smallpox, yes. Yes. Shingles, yes. COVID-19, no. There's no way a patient can come to anybody and say, I have a dry cough, do I have COVID? See, no, you don't know that. And even if they do an antigen test, as we've discovered before, that the antigen test testing positive for genetic material may indicate, according to the CDC, they say it may indicate that there may be an active case of COVID. Maybe. They cannot know when the person is infectious. See, they don't know. There is no test to tell when a person is infectious. There is no test of the incubation period either. Okay, those are facts. Okay. See, look at this. People in the hospital beds how do you know they have COVID-19? See, if there's no marker for COVID-19, how do you know these people have COVID-19? See, they test positive for the antigen, and it may be they have an active case of COVID-19. See, number of people. None of these mentioned hospitalization or admission infer that the numbers only relate to patients because of 19. See, they can't tell. They can't tell if the patients are in there. Yet people are going around with masks as though this thing. See? And 80%, 85% of these have little or no symptoms. And the deaths that they say are respiratory illnesses. Yeah, these are complications of something that the person has, but there is no causality relationship that this pneumonia or other respiratory illness was caused by the COVID virus. See, the number of patients with coronavirus symptoms. But you've seen the number of coronavirus symptoms. There's like 15 of them, and they're not unique to anything. They can be pneumonia, they can be the influenza, they can be the seasonal flu, they can be anything. And this is why this is such a terrible paranoia that's being set on the world public, of those who have contracted the virus. What do you mean contracted? You know, the SARS-CoV-2 was around the world before they found it in China. They say they discovered it in China. No, they developed a test for it first in China. It was already around the world, just like the influenza flu, just like so many other viruses are already around the world. And you start producing a test for these other coronaviruses and the other types of viruses that are in our bodies that we don't even know about now. And there's not a period of infection. There's a period of discovery by test that this is so. And you see, you look at the data here, and you see that the inferences that they have drawn are inappropriate. See? Now here they've tested positive. Well, what is the test? Is this a viral test? Is it a molecular? Is this an antigen test? Is it an antibody test? See? They're all quite different. And when they say contracted the virus, does that mean that they tested positive? Well, if it does, were they positive a week or year before? See, we don't know that. And so they say they contracted the virus. No, we have detected more people in a population that have the virus because we've testing more people. See, you see how this is, and they say that these have died. Well, they acted as though that these people have died from this. See, and we don't actually know that, as you can see. And here are the definition of people needs to be clear. The number of people due to COVID-19. See? Yeah, so what is it? If COVID-19 has no marker for symptoms, and somebody comes with a sore throat and you say it's COVID-19, they test positive with an antibody or any test, that doesn't mean that the sore throat or lack of cough is attributable to COVID-19, because it's not unique. See? Now with mumps, somebody comes in, the glands are swollen and all that stuff, and they test positive for the mumps. Well, you know they got mumps. But somebody, you take a list of the 15 characteristics that they now say, and they used to have others on there. Realize? Right. That list used to have others on there originally, and now those are gone. You understand? I know for a fact that one of them was lesions on the feet. It used to be there. Why is it not there? Why are these symptoms not stable? And they're acting as though you can tell when you have the coronavirus. And 80-85% don't have symptoms. And what they attribute as hospitalizations, you don't know. Respiratory illness, I don't see any causal relationship between the COVID symptoms and respiratory illnesses, because there are far too many symptoms of COVID. There's not too many of them, you know. I mean, if a COVID virus had only one, right, as a fluid in the lungs, you know, you could see the causality in creating pneumonia or something. But COVID doesn't have anything like that. And you see, this stuff is so misleading here. And here's some unanswered question. See here, look, the number of people in the hospital at the time of diagnosis. You see, this is what we're talking about. You know, people that look like they have COVID, look like they have the COVID-19, but they don't, and they're in the hospital. And a lot of the CDC and others are trying to say that, well, they are COVID-19 because it's related. You know, well, we don't know that. See here, another thing. See this how misleading this is. You think that you're reading this and you don't realize the number of people admitted from the community with a diagnosis of COVID-19. So we need to answer some clarifying here. What does it mean by diagnosis? See? Right. According to the ambiguous and vast list of 15, quote, characteristics that could apply to any number of viruses and other diseases and conditions, not just, it could be organic or anything, right? There's no place that you can see that there is a diagnosis for COVID-19. There is no place where there is a definitive diagnosis according to symptoms for COVID-19. There is none. There is no unique markers for COVID-19, and yet they're trying to use it every day. And they're attributing death to it and all kinds of stuff to create panic and paranoia. You cannot diagnose COVID-19 from the list of symptoms. You cannot diagnose COVID-19 from antibody tests. That does not indicate the presence of disease. See? And even the antigen tests only indicate there may be an active virus. And furthermore, there is no test to say that there's an infectious period or when it is. And there's also no test for indicating an incubation period, yet they're instituting all kinds of shutdown measures around the world as though they knew these things. And yet, there's little or no symptoms to any of it. And if you look at the related deaths, quote, related deaths, what they're saying are deaths due to COVID-19, there is no, the substantial evidence is not there. But you see how serious this is. There's no way you can get doctors to look at this. You can, you can't. There's no way you can get the CDC to say there's no way to determine what they say they're determining. See here again, diagnosis of COVID-19. You can't do it. According to symptoms, you can't do it. According to the antibody test, you can't do it. You see, and that's the majority of it originally. You can't do with an antibody test. That does not indicate that it's going to be spread. That does not indicate the person has the disease. It's a contraindication that somehow the virus has already been there. That doesn't mean there was disease, but the body had contacted with it and has created antibodies. That's good. That's healthy, Now, right now, October 20th, they indicate that there are around 40 million people who have tested positive, okay, in one way or another, right, tested positive for COVID-19, from the SARS-CoV-2 virus, right? And there's huge paranoia. Well, what about and that's with little to no symptoms, right? 85%, little to no symptoms according to everybody, right? What are people worried about, for Christ's sake? And yet the influenza rate in the United States alone averages somewhere around 40 million just in the influenza flu, not to mention the swine flu and the avian bird flu and other types of viruses that are virulent in Americans' bloodstream. Now, that's 40 million just for that one influenza flu. And around the world, same thing. I hadn't Googled it, but probably, if there's 40 million in the United States, then, well, there must be 250 million around the world that are infected. And these people are in bed. When you have the influenza flu, you can't say 85% have little or no symptoms, okay? And the amount of loss of work time and everything from the influenza flu around the world is so much greater than the COVID-19, which has little or no symptoms for 40 million worldwide. You see, the imbalance, the severity of the flu influenza flu is very large, and the other flu is the seasonal flu. Why? As I say, this is a huge amount of paranoia. Literally, it's terribly off base. Now, here's another one. Look, this is the Miami Herald. Okay, think you have coronavirus. Here's when and if you should go to the hospital. Well, here we have the coronavirus outbreak. Right, an outbreak of no symptoms. Right, an outbreak of no symptoms. I like this. Okay, so this can be tricky given the small amount of science, right? The small amount of science, notice this, the small amount of science behind COVID-19. That's exactly it. That's exactly it. Pay attention. According to the symptoms, you cannot diagnose COVID-19. Here we are. I have COVID-19 symptoms. Should I go to the hospital? These are the people that are going to the hospital. You wonder why people are getting hospitalized? Because of paranoia like this. It's important to recognize the initial symptoms associated with this. Dry cough and fever. Well, what about influenza? How many things does this go to? You see, the list for coronavirus is is so many. It's impossible to do this. But just developing those 2 doesn't mean you should go to the hospital. Well, maybe you should wait till you develop 7 more, you see. See, listen to this. Look, who develop cough and fever, yeah, there's no need to panic. There are a lot of viruses that produce these type of symptoms. It's exactly what we've been saying. You have no way of diagnosing COVID-19 from symptoms, and yet they do it. See, you go in, you say, oh, geez, I'm really worried. I have a dry cough. I have something on one of the 15, and they say, okay, we'll test you, and you test positive. Okay, therefore, you've got COVID-19, right? No. You tested positive for the antibodies, which does not mean the presence of disease. See? Now, if they use an antigen test, well, there may be the presence of an active COVID-19. That does not mean it's contagious. It does not mean the symptoms that you feel are actually the symptoms of the COVID-19 that's active. You see? See that? That's right. You can't tell these things. And here we are, like the elderly. Well, of course, you're gonna develop severe symptoms. Others who are far more likely. I mean, that's true of. I mean, the influenza flu every year kills tens of thousands of the elderly. That's what happens to the elderly. This is not unique to the virus at all. Look at this. Combined with difficulty breathing or a compromised immune system, follow their advice. I think, what's this difficulty breathing? If you got the flu, I mean, you always have difficulty breathing, fever for what, and difficult, I mean, I don't know. I mean, as again, there's not a marker here for this. Look at the sign of symptoms they've got here. It's just, and here we are. Look at this one. See? Symptoms from COVID-19, which can resemble a life-threatening case of pneumonia. They're not presenting any evidence that there are any symptoms on that list that would cause something similar to pneumonia. Okay, it's not there. Pneumonia, we know those things. There's markers for that. There are no markers for this guy. Okay. See, look, the symptoms are mild. Take a look at the list here. And if you have those severe symptoms, you see there is no indication that those severe symptoms are COVID-19, because that list is not definitive for COVID-19. You might think it's not pneumonia, and maybe it is. There are all kinds of respiratory illnesses. Okay. And they're trying to act here as though maybe it's just pneumonia and everything else is COVID-19. See? And that isn't true. See, all this stuff is they're acting as though this is all attributed to the COVID-19, you see. And one thing they don't do is if you test positive for the COVID-19 in the hospital, how about testing for one of the other 100 viruses that may be there and other respiratory illnesses? See, do they test for pneumonia when they have something that looks like that? I don't know, but pneumonia, there are a number of pneumonia cousins, of the pneumonia family viruses, and there's a lot of this stuff, you see. And as I said in Siberia, the mayor would not go along with CDC saying it was due to coronavirus. See, here's another one. See, problems with it. See, there's so much confusion of this, you see. Um, an older strain of coronavirus. See, there are a lot of coronaviruses. It's unlikely that, now why is it unlikely if it tests positive for this that it wouldn't be for that? See, is this the antibody test or the antigen test? You see, this is very confusing to the public, and this is the Miami Herald. You know, they should have this stuff down, but they don't know. See, and even the doctors don't know this stuff, and you have to realize that. Look at this. If you have a and you identify an old coronavirus, then that's what you've got, right? How are you going to test? How are you in your home? How are you going to identify that you have an old coronavirus? You see, and then you say, oh, well, that's what I've got. See, I don't have COVID-19. So you said it would be it would be difficult. How difficult? I mean, do they actually know this? See, in other words, can you get reinfected? Well, I don't know. With the flu, you can have a relapse. It's usually unlikely you get a recase of the influenza flu, or in the same month. See, here's it. Now they're beginning to use some common sense. See. See, notice the uncertainties we got here. Okay. See, we're going to put $2 trillion more and dilute the dollar more. Very dangerous situation to create hyperinflation here, and that's what that would do. Well, that's it. I think I haven't seen any. See, look at this stuff. He adds to new deaths. Adding new deaths here. I mean, and these are probably related deaths. It could be that these were other cousins of the pneumonia virus that the person had, and they tested positive antibodies for the COVID-19. So they said the pneumonia was responsible by being caused by the COVID-19, and that's what they did in Siberia with that mayor. Okay, it was actually COVID was present, but it was pneumonia that killed the residents there. Okay, but this is the typical of what's happening in this around the world, and CDC is primarily right at the forefront of misleading people about the severity of the situation. 38 million testing positive in some way, and little or no symptoms to 85%. And go if you have a coronavirus to the hospital. Well, according to the list of symptoms, probably 90% of the population of the United States go to the hospital at least once a week, literally, and then completely ignoring the fact that the influenza flu is in the 200 million or so around the year, and far more damage to the economy than the paranoia that's shutting down, particularly England. I mean, that prime minister is nuts over there, and France and Italy and Germany. I mean, these people are scared. These people are so scared, and yet, and you see, I don't see the basis for it. I don't see the causality here. I see I just don't.